Hello, everyone, and welcome to another audio podcast. In this series, the Equity Intermission. And Today I'm going to talk a little bit about the. I'm going to talk a little bit around healthcare education for best practice, and in aligned to a quantitative inquiry. This work has been a collaborative effort between between two social media platforms, the Renal Patient Support Group, the RPSG, and the Kidney Disease Renal Support Group, and KDARs for kids, and also in collaborative from an academic and a healthcare perspective, as a healthcare professional perspective as well in that regard. And Once again, this is the Shientist, and I'm going to highlight this work by providing a sort of an overview of this. And at the end of this work, I am going to say that this work, I am going to provide the abstract around this work as well, so that there's a sort of a synopsis format after I've given the overall perspective on this. And also just to highlight that this work has been or was presented as a poster presentation at the American Society of Nephrology 2021 conference, and the title of the poster presentation was respectively highlighted as nephrology research and integrating education for best practice, a quantitative perspective. So to begin with, I'm going to highlight I'm going to highlight the sort of background behind this first, or initially. So patients diagnosed with long-term conditions are perhaps the most rigorous consumers of health and social consumers of health and social care. A GP practice of 10,000 will have at least 500 patients with chronic kidney disease stage 3 to 5. Approximately 15 to 20 of these patients or individuals will be in CKD in CKD stage 4 to 5, and around 10 patients or individuals would be in CKD 5 specifically. A more elderly or deprived practice population is likely to have a higher prevalence. About 90% of patients or individuals with CKD stages 3 to 5 will have hypertension. 40% will have vascular disease, and 30% will have other conditions. Full details of current prevalence of chronic kidney disease stages 3 to 5 are recorded or have been recorded by the UK Renal Registry, and the UK Renal Registry currently have updated chapters around the epidemiology around different aspects of chronic kidney disease. The all-cause mortality rate in chronic kidney disease is 30 to 60 times higher than in the general population. Patients are now being prompted more towards self-care, and this can cause anxiety and stress triggers. It is important to gain better insight into the types of stresses experienced by patients in chronic kidney disease. So there is a push for using sort of technology to bridge knowledge gaps in healthcare, peer support, and education. But further research still needs to explore guidance and areas of peer support and patient education. In this context, there is also a requirement to evaluate guidelines for patient and public involvement and focus on where commissioning is wanting. A few focuses could surround, for example, e-health and e-learning modules where patients and professionals co-produce initiatives. The UK government has emphasized the importance of technology in improving health outcomes and providing smarter patient-centric care. Such initiatives would be supplementary to care documents that already exist as part of electronic patient records or EPRs. Of course, any health education provided will also require documenting and transfer of information. Connectivity of any future technologies or links between electronic patient records and knowledge provision would need to be fast, reliable, and also general data protection regulation compliant. There is now ever more need to improve healthcare integration for people with long-term conditions, and this remains as one of the most important challenges facing the National Health Service, and of course, in some contexts, as a society. With advances in point of care, improving care for people with long-term conditions must involve a shift from a reactive, disease-focused and fragmented model of care towards a more proactive, holistic, and preventative one, wherein people with long-term conditions are encouraged to play a central role to take ownership. I'm now going to talk a little bit around chronic kidney disease epidemiology in the UK. The epidemiology for actual chronic kidney disease in the United Kingdom relates to what has been outlined by the National Institute of Care and Excellence guidelines and KDIGO guidelines from the United States. Similar epidemiological context has been informed by primary data by the Health Survey for England (HSE) in 2009 and 2010, using estimated glomerular filtration rate and albuminuria. The incidence rate of chronic kidney disease in the UK increased from 109 per million population in 2013 to 115 per million population in 2014, reflecting renal replacement or RRT initiation for 7,411 new patients. The increase in incidence rate from 2013 to 2014 was seen in England and Scotland, although rates in Scotland have fluctuated since 2008, but not Wales and Northern Ireland. The median age for all incident patients was 64.8 years, although highly dependent on ethnicity. 66.4 for white incident patients, 58.7 for non-white patients. So more patients are being encouraged to take ownership of health, and whilst there has been research, little is known about what topics and subject patients discuss and share through social media platforms, or accept that some patients will seek further understanding surrounding relevance of blood tests, investigations, and parameters according to disease, especially in context of electronic patient records. Certainly, access to electronic patient records does not guarantee that patients know how to use the information, and there is little understanding how effective online consultations are. Patients want more understanding of health in a range of areas, and want allied health professionals or AHPs to be part of discussions where they can get more rounded, more robust education. This would also reduce inequity, increase literacy, and language, and improve overall population health. Several determinants need to be challenged, particularly risk factors relating hypertension and other conditions. The 3% increase to the NHS National Health Service in 2009 has increased the number of patients requiring renal replacement therapy in 2010, and this is causing issues on national health spending. A stance is needed to consider the trends, and this could constitute an improved service and management of actual CKD or actual chronic kidney disease. I'm now going to talk a little bit about gaps in provision. So around 70% of total health and care expenditure in England, in the United Kingdom, is all attributed to patients with long-term conditions. An estimated 15 million patients in the United Kingdom have at least one long-term condition where the prevalence of cancers and chronic kidney disease rising and chronic kidney disease increasing. This consequently has an impact on access to lives, has an impact on lives and services and healthcare impact more and on healthcare more generally. About 2 million adults in the United Kingdom have been diagnosed with what's been referred to as moderate to severe chronic kidney disease. Much of the monitoring in these patients occurs in mild or moderate disease by patients in primary care with only the final stages of the disease managed in secondary care. These processes are often inadequate, resulting in miscommunication to patients and insufficient education given. General practitioners use criteria agreed in local guidelines to request advice or question the need for hospital clinic review. Primary care records are generally not accessible to secondary care staff. Consequently, telephone calls and referral. Certainly, access to electronic patient records does not guarantee that patients know how to use the information, and there is little understanding of how effective online consultations are. Patients want more understanding of health in a range of areas and require to be part of discussions where they can get more informed care. By encouraging education and relating context across a range of health disciplines, this would also reduce the burden of chronic kidney disease in the population. I'm now going to talk a little bit about chronic kidney disease and by patients in context of patients seeking educational support. So it's been almost 2 decades since the United Kingdom government published a document, The Expert Patient, a new approach to chronic illness, chronic disease management for the 21st century. The intention was that service users would lead others by example, being experts in disease management. Although this initiative was published in the UK, in Australia there was one team who identified where expert patients in chronic kidney disease recognized areas of development related to good quality information. There was an issue surrounding the provision of appropriate culturally aware information and knowing who to contact for help. This was especially important in remote communities with limited access to healthcare. The inclusion of expert patients or service users is not reported in the literature. Patients and carers take responsibility for health management and treatment regimens. Patients living with chronic kidney disease can benefit if they receive appropriate support for self-care. The measurement of psychological distress and quality of life allows to inform that intervention is beneficial for families with post-transplant children and young people, for example, in at least some context. Now, patients seek out support through online and self-help social media platforms, which are one of the most promising aspects of online spaces. The use of health educational support through social media platforms increases patients' understanding of subjects through sharing experiences and encouraging self-empowerment, increases confidence, self-esteem, and can reduce health inefficiencies. eHealth meets some of the challenges, such as bridging educational support for approaching and navigating healthcare can be and approaching and support for approaching and also in and around navigating healthcare, where that can also be problematic. The increased awareness and use of e-health services is associated or has been associated with high levels of literacy and educational attainment. Patients require rounded, robust understanding of disease and processes. Depending on stage and severity of chronic kidney disease, the patient must gain comprehension of treatment modalities in line with care pathways. This includes peritoneal dialysis, hemodialysis, or home hemodialysis, in-center dialysis, and transplantation, and how treatments are delivered. For example, dialysis access through arteriovenous graft, arteriovenous fistula, central venous catheter, or peritoneal dialysis catheter. Patients also require rounded understanding of treatments in related to medication, side effects, and physical aspects of disease and well-being, especially if heading towards, so that adverse interactions can be avoided. Educated patients become empowered and can make informed decisions surrounding treatment choices. I'm now going to talk about something that's quite an involved subject, but in this work, it had been highlighted in more of a sort of a contextualized way. So, primary care networks and allied health professionals. So primary care networks build on the core current primary care services and seek to prompt a greater provision of proactive, personalized, and coordinated and more unified health and social care, unified health and social care services. Clinicians describe this as development from reactively providing appointments to proactively care for patients at primary care level. Where emerging primary care networks are in place in parts of the country, there are clear benefits for patients and health professionals or allied health professionals. So, for example, one review found allied health professionals face diverse encounters dealing with multimorbidity, including overcoming polypharmacy, challenges caused by fragmented healthcare services and technology, barriers to shared decision making in the provision of patient-centered care, and complexity of following various guidelines. Providing staff age-centered education surrounding kidneys is important owing to changes in health and disease over time. Primary care staff should also keep up to date with aspects that surround patients at risk and consult renal guidelines to meet best practice. It is good practice to ensure renal function and medicines use are regularly reviewed with a general practitioner and other qualified allied health professionals. Overprescribing and disease monitoring differ internationally, and this has been the case over 2 decades. More educational interventions are required to support best practice. This could be achieved through collaborative working through primary care networks, prompting allied health professionals to be involved at primary care level. Patients may additionally require supplementary education and advice to help search out education to steer clear of misinformation. I'm now going to talk about the aims, some of the aims around this work and in context. So the aims here of this work were the healthcare information seeking behavior of patients with chronic kidney disease is important to understand because patients want specific want specific medical or scientific understanding to be able to communicate efficiently with healthcare professionals. There's works by a team. I believe it's a Dutch team from 2017, and they look at the use of online support groups and social media platforms, and in context of trying to understand whether information that is being shared or lived experience that is being shared, whether there's any clinical relevance in context of in some context in relating to coding with electronic patient records, and also in relating to generally where through online support groups where service users, for example, may primarily be just talking and communicating with no end to particular questions. So this particular team, this Dutch team in 2017 were investigating the clinical context that come through online support groups and social media platforms. Given the significant consequences to patients' health and impact on healthcare, this is important to understand. In following understanding by research of research, and there's several additional authors that look at work surrounding healthcare disparities, and from research by Mohammed and team in 2020, this research or this work sought to understand where there are healthcare inefficiencies, and to identify what requirements are still needed or still need to be met surrounding chronic kidney disease patients. With the aims, there were several objectives as well. So, using a quantitative data collection methodology, the aims and objectives of this work included number one, to understand which topics and subjects are most important to renal patients. Number two, to understand whether retrospectively there has been neglect on the education part of healthcare delivery in the physical realm. Number three, to understand on which topics would CKD patients find further support helpful. Number four, to understand what education should be made available internationally. And number five, to understand how healthcare and education for patients with chronic kidney disease could be more integrated to have so that patients have more ownership over their healthcare. So this work had to go through an ethics application process, and I'm going to talk a little bit about that. This research proposal had undergone both an academic institution ethics approval process and National Health Service ethics approval process, highlighting all aspects of the research. General Data Protection Regulation, or GDPR 2018 guidelines were also implemented to ensure practice surrounding confidentiality, data protection, and compliancy. Information sheets, consent forms, sheets and consent forms were produced to inform participants the intentions and the outcomes of this research. All participant data had been collected outside the academic institution site and housed on a secure server with a firewall protection at the academic institution, within the academic institution. The research protocol, there was a research protocol identification with this research, and alongside that, I'm going to highlight a little bit around the recruitment process now. So the investigating team seek to collect quantitative data between five polls from January 2020 to September 2020 to help understand the educational support requirements through social media platforms and online spaces. So a sample calculation was not carried out. However, a target sample was implemented to seek 100 responses between chronic kidney disease patients and allied health professionals through the Renal Patient Support Group, or RPSG, platform. In the manuscript, in the work, there is supplementary information in relating to context around the two social media platforms, and I will go through the rest. I will go through this work before getting to that section. So a little bit around materials or methods. An investigation for 1 month between March 2020 and April 2020 collated the most popular terminologies that have been used through the social media platform. This resulted in 14 different topic tags being developed. Topics were tagged for 2 weeks per social media platform: the Renal Patient Support Group, representing the online adult chronic kidney disease population, and 2 weeks through the pediatric or young people or kidney disease renal support group, or KDARs for kids, representing the online pediatric or young renal population or kidney disease population. Topic tagging aided understanding of healthcare areas that are popular and where patients between the social media platforms would benefit from further educational involvement. Topic tags were developed for this study wherein topics between two social media platforms were co-developed, being understood, were co-developed, having understood aims and remit of social media platforms. Topic tagging has also has been highlighted in previous research works by Morrison 2005, Sivian and Pratt in 2007, and Zhong last year in 2021. So after that, there was an effort where as part of the methodology, we conducting a 16-year of a retrospective pilot pilot descriptive analysis of topics and educational efforts between two social media platforms initially sought to understand where there are healthcare inefficiencies and to identify what requirements would still need to be met surrounding chronic kidney disease patients. Platform leads or social platform leads of both pediatric and adult renal social media platforms signposted investigators of how members share experiences and provided a link to platform disclaimers regarding remit and focus on chronic kidney disease stages. 14 educational topic tags specifically helped investigators and platform leads to co-develop 2 surveys to help understand areas surrounding aims and objectives. In the works, in this manuscript, there's a table that highlights that 1,311 topics were tagged and applied over a 2-week duration between March 2020 and April 2020 through the Renal Patient Support Group, and 1,249 topics were tagged and applied over 2-week duration between March 2020 and April 2020 through the Kidney Disease and Renal Support Group, or KDARs for Kids social media platforms. So in following, one survey was implemented for allied health professionals and one was implemented for chronic kidney disease patients. Before I go on any further, in relating to the survey or the surveys that were implemented, they were primarily a focus through the Renal Patient Support Group, the RPSG, the adult population relating to chronic kidney disease, and not so much the Kidney Disease and Renal Support Group, or KDARs for Kids. Although the RPSG and KDARs for Kids together co-developed the topic tagging activity that was a preempt to this work. So again, in following, one survey was implemented for allied health professionals and one for chronic kidney disease patients. Descriptive analysis was then implemented to analyze pilot data. The data collected followed on from research by Mohammed and team in 2020, and actually also in relating to works by the Dutch team, Van Dam and team in 2017. Qualtrics survey links. Qualtrics is a survey tool a survey tool used in academia, and Qualtrics survey link was made available for 6 to 8 months through both social media platforms. However, although most of the remit around this work, again, after doing the topic tagging activity, was primarily focused on the adult on adults with going through chronic kidney disease. However, the academic from an academic perspective, we did approach the KDARs, or Kidney Disease and Renal Support Group, KDARs for Kids, was approached to see if it was okay to put the link on their social media platform as well. And so participants only had to complete the survey once, and the surveys were prompted through a dedicated section of the Renal Patient Support Group website as well, wherein chronic kidney disease patients and allied health professionals could find out more before completing the surveys. And given that both social media platforms have international membership and global reach, it was important to ensure that educational topics and tags applied to general renal population and not specific to pediatrics and or adults going through chronic kidney disease. And this would help gain sort of a maximum number of topics tags between the social media platforms. And primary research developed through coordinated efforts between RPSG and KDARs were validated in research by Mohammed and team in 2020. So I'm going to talk a little bit more around the results and the descriptive analysis, and there's quite a lot of sort of data, descriptive analysis data in this research or in this work, but I'm going to do my best to give an overview. So quantitative data was analyzed descriptively to inform frequencies of variables and differences between variables. Quantitative analysis helped identify if there is a role for allied health professionals to support patients with chronic kidney disease in primary care and to establish any correlations against similar research. All quantitative data was analyzed using Qualtrics software, which was the academic institution's approved service for quantitative research. Equally, Qualtrics helped quantify data numerically and help understand whether there are any statistic significances. Qualtrics software was the only online survey software validated and authorized by the particular academic institution. So I'm not going to talk about the results around this in context of a health focus health focuses relating to chronic kidney disease patients and then healthcare professionals. The research team seek to collect baseline data relating the following themes between two cohorts. So from the chronic kidney disease patient population, the following questions were posed, and these questions are in context are also relatable. They're relatable themes. So number one was describe your chronic kidney disease status. Number two, your perception of chronic kidney disease in primary care. Number three, whether they received extended education. Number four, future models of care. Number five, chronic kidney disease and primary care education. Number six, technology and digital healthcare. Number seven, information, communication and technology or ICT. Number eight, appropriate support surrounding healthcare access. Number nine, healthcare communication and support. Number 10, influences on taking ownership. And number 11, ongoing learning and care. Number 12, gender. Number 13, age. And number 14, ethnicity. So a little bit around some of the data, some of the results in relating to some of the statistics. And for anyone listening, basically in this research there was no fancy statistical analysis that was implemented. It was just basic descriptive analysis because at the same time the investigators knew that given the sample that was anticipated, or the number of potential respondents, on that basis there was no sort of fancy statistical analysis that were anticipated. So basic descriptive analysis was implemented. So CKD patients that contributed the highest included transplant patients. So there was just under 61% who contributed in that. Second were end-stage renal disease patients, those particularly who were on hemodialysis. So around 13% or just over 13%. And patients with chronic kidney disease, stages 3 to 5 specifically, just under 11%. The lowest responses included chronic kidney disease suspect or high-risk patients, which was actually at 0. Chronic kidney disease stage 1 through 3 is 2.63%. A total of 38 responses were established from that particular question. Patients with chronic kidney disease who contributed relating appropriate support surrounding healthcare, the highest response included where those who were completing the survey had options from different pretexts within the survey, and the highest response included, I have ability to communicate with a health professional about blood tests and investigations. That was 25.49%, so just under 26%. The second highest response included healthcare professionals should be prompted for more patient engagement activities, which was 23.53%. And then I have links to patients with chronic kidney disease for peer support are needed. And I have links to patients with chronic kidney disease or CKD for peer support and are needed so I can share experiences, and that was also 23.53%. The lowest response included the lowest response also included I have ability to access supplementary education from allied health professionals who conduct laboratory investigations. So that was just under 6%, 5.88%. There are various figures to highlight the data, the full data in this manuscript, in this works, there's generally figures. There's figures 3 to 14 typically highlight data surrounding extended education, future models of care, chronic kidney disease and primary care, technology and digital healthcare, information communication and technology or ICT, appropriate support surrounding healthcare access, healthcare communication and support, influences on taking ownership, and ongoing learning and care, and gender, age, and ethnicity. I'm now going to highlight some of the context relating health focus around the health professionals who contributed to this particular survey, and the following questions were posed. This number, so carrying on from the previous. So question 15 was describe your profession. Number 16 was perception in primary care. Number 17, extended education provision. Number 18, future models of care. Number 19, chronic kidney disease and primary care education. Number 20, healthcare professionals and electronic patient records. Number 21, patient care and electronic number 21, primary care and electronic patient records. Number 22, Information Communication and Technology, or ICT. Number 23, Technology and Digital Healthcare. Number 24, Allied Health Professional and Future Roles. Number 25, Skill Mix and Leadership. Number 26, Safety and Governance in Primary Care. Number 27, Screening and Biomarkers. Number 28, Gender. Number 29, Age. And number 30, Ethnicity. So, the results around this were two of the highest response relating information communication technology included. One of the principal roles of healthcare professionals is using information communication and technology, where just under 17% contributed to that, so 16.67. And technical issues is a barrier to information communication technology, and again 16.67 was the percentage around that. The second highest response relating to information communication technology was where healthcare professionals are unwilling to use or contribute through information communication technology, and the percentage around that was 11.11%, so around 11%. And two of the highest responses related allied health professionals and future roles will increasingly work with general practitioners to provide laboratory screening and point of care testing advice and education, and the percentage around this was 16.67. And healthcare scientists and allied health professionals would deliver more National Health Service professional services such as educational support, understanding of disease trends, medicines and medicines use reviews, and 14.29% was the percentage around that. Two of the second highest responses included allied health professionals provide more supplementary education and health promotion services, and the percentage around that wasn't particularly high, but it was 9.52%. And allied health professionals will support general practice, GP practices more efficiently, streamlining practice, and the percentage around this was 9.52%. Three of the lowest responses included patients will have access to allied health professionals through educational podcasts or webinars, and the percentage around this was 2.38%. Patients will have access to allied health professionals through a smartphone for supplementary education and support, and the percentage around this was 2.38%. And patients will have access to allied health professionals through social media or instant messaging apps for supplementary education and support, and the percentage around this was 2.38%. Figures in the peer review manuscript, or the manuscript that had been prepared around this, figures 25 to 30 summarize the data surrounding skill mix and leadership, safety and governance in primary care, screening and biomarkers, gender, age, and ethnicity. I'm just going to highlight a little bit around the discussion now. So ensuring the healthcare scientist workforce, or ensuring that the allied healthcare professional workforce has adaptability to transform as technology develops will be key to accomplishing the correct parity of proficiencies for the future. By 2030, healthcare scientists, for example, could perhaps by 2030, healthcare scientists and allied health professionals could perhaps expect to be better integrated into patient pathways, working as part of a multidisciplinary team and working and working and conceivably through online group consultations or similar. This would prompt a smarter working sort of relationship across professions to drive an all-encompassing approach to chronic kidney disease care pathways to convey better outcomes for patients. There is a potential role for allied health professionals to support and supplement educational initiatives through digital platforms and online spaces to bridge gaps in misinformation. The potential for allied health professionals to help improve the quality of advice and education for chronic kidney disease patients requires further reflection. Future research will potentially need to explore measuring quality of allied health professionals, like in works. There's works by an author, Horrocks and team, in 2018 that looked at sort of an evaluation of allied health professional workforce, and relating this to digital advice and educational support. Education could be delivered through allied health professional-led clinics. Allied health professional-led e-clinics to support patients as part of chronic kidney disease best practice. That being said, until allied health professionals are made available online, prompting education as part of health service, both literacy and healthcare remains somewhat disjointed. It is, number one, important that education provision is provided in times where patients are seeking out answers to supplement healthcare, and two, it should be appreciated that without allied health professionals being available online, peer support alone potentially leads to misinformation. I'm going to highlight, as part of this discussion, I'm going to highlight some context around the surveys specifically. So surveys did not employ a scoring system, since this would have made analysis and completion challenging. Online versions of the surveys were also shortened, and simple tick box method was applied. 19 surveys were completed from allied health professionals, and 45 were completed by patients going through chronic kidney disease. Respondents from the patient cohort had demographics with varying ethnicity, age range, and gender representation. Respondents from professional cohorts were predominantly from white backgrounds, higher education status, and primarily female. Allied health professionals that contributed included healthcare scientists, which was around 47%, nephrologists 17.65%, allied health professionals healthcare scientists specifically 47%, nephrologists 17.65%, allied health professionals 17.65%, and general practitioners 5.88%. And patient cohorts included transplant patients at 60.53%, hemodialysis patients 13.16%, and chronic kidney disease patients chronic kidney disease patients in chronic kidney disease stages 3 to 5, 10.53%. And education needs to be measured and continuous to achieve best practice. And following on from that, I am going to highlight some context relating to the strengths and limitations around this work. So one of the limitations of this investigation relates to the number of the survey responses from both allied health professionals and chronic kidney disease cohorts. Respondents from patient cohort and had demographics with varying ethnicity, age range, and gender representation. Respondents from health professional cohort, again, were predominantly from white background, higher education status, and primarily female. And that notwithstanding, though there was limitation regarding the generalizability of pilot data collection, greater use of skill mix will be more important if allied health professionals and patients, for example, want to see best practice beyond confines and constraints of traditional consultations. The aim should be to equip allied health professionals and patients with education and knowledge base to ensure there are mutual objectives between service users and providers, and thus to also ensure education stems at the very heart of nephrology or kidney care. The effort should envisage efforts between health sectors. So I'm now going to just highlight some conclusions, and again, the full works, the works around this will be available through the Renal Patient Support Group, the RPSG. So around the conclusion, then, chronic kidney disease patients have been sharing lived experiences and understanding between two renowned online social media platforms to help inform smarter care and decision making. Using social media platforms and such platforms as space wherein they otherwise have limited peer support and communication. One could debate, for example, what context and understanding is deemed as clinically relevant. And again, in works by the Dutch team, Van Dam and team in 2017, they asked that question, and they investigate to an extent. So patients in this work and in works by Mohammed and team in 2020, the works by Van Dam in 2017 have also been answered by the works of Mohammed and team in 2020. So in part, this is what the answer is, some of the answer around that. So patients are not trained to communicate clinically relevant context, and it could also be debated that most of the shared experience through social media platforms is actually all important and relevant. Patients have own ways of sharing, understanding, interpreting, and communicating health complexities. This snapshot study highlights the need for broader healthcare professional involvement to support patients seeking out education in addition to peer support. Education could be equally delivered through online podcasts and webinars, as the National Health Service needs commissioning, as the National Health Service (NHS) needs commissioning, and healthcare requires investment around this. This is the first This is the first international retrospective study that examines relevant educational gaps between allied health professionals and two chronic kidney disease populations close to 2 decades. Co-developing educational modules involving patients and professionals would prompt more joined-up care in meeting educational needs and addressing healthcare inefficiencies. This is important. This is an important investigation that could inform clinical management. Again, the full works will be made available through the Renal Patient Support Group, the RPSG, in time, the abstract around this is thus as well. So the introduction is technology has allowed patients with long-term conditions to access information through websites, portals, and patient-centered organizations. The aims and objectives around this are conducting a retrospective pilot descriptive analysis of topics and education efforts between two online social media platforms. This research sought to understand what requirements healthcare education need to be met for chronic kidney disease patients. The ethics around this was that GDPR 2018 guidelines were implemented to ensure best practice, and the research there was a research ethics protocol ID for this investigation, and the methodology around this was that between two research social media platforms, again, the Renal Patient Support Group, RPSG, and the Kidney Disease and Renal Support Group, KDARs for Kids, implemented educational topic tags, where the topic tags were applied to different topics between the social media platforms, and after that, a target sample was implemented to seek 100 responses between chronic kidney disease patients and allied health professionals through the Renal Patient Support Group, or the RPSG. Participants were invited to complete a survey once only, and the analysis around this was Qualtrics software was used to describe and analyze data. 19 surveys were completed by allied health professionals, and 45 surveys were completed by chronic kidney disease patients. The results around this are again in brief summary. The highest responses were from allied health professionals, allied health professionals who were female, 57.14% versus males, 42.86%, and relating to chronic kidney disease patients, females at 55% versus males 38.89%. And the types of allied health professionals included were healthcare scientists at 47%, nephrologists at 17.65%, allied health professionals that were also other than healthcare scientists were 17.65%, general practitioners 5.88%, and the patient cohort, CKD patient cohort, included transplant patients at 60.53%, hemodialysis patients at 13.16%, and chronic kidney disease patients chronic kidney disease patients with CKD stages 3 to 5 at 10.53%. Discussion around this: online educational modules should be co-developed and linked to chronic kidney disease educational pathway. The conclusion around this work is this. This is the first international retrospective study that examines relevant educational gaps between allied health professionals and two online chronic kidney disease populations. And some of the main words in relating to terminology, if looking for similar papers or publications and works online, are terminology such as education, chronic kidney disease, and nephrology. I now draw this audio podcast to a close. Thank you for taking the time to listen. And this is the Shientist in this series, the equity intermission. And this was audio podcast on healthcare education best practice, a quantitative inquiry. Thank you.